second. Yeah. I think that's good. So you see it, yeah? Is it okay? Do you say it? Tell me if you have any problems with viewing. Sorry?
Yes, we can see.
Okay, thank you. Thanks. So we're today talking about the rubber dam, everything that means that the things that you will need in your life, just how to approach the rubber dam and the things that you might need on your OSCE exam. So we spoke about these things in the practical part, but we need some more, I think, and I will start from the beginning. And if you have any question, you're just interrupting me. So what is the kit of the dental rubber dam isolation kit? What we will have in this kit, in the usual situations, this is the basic kit where we have these components. That means that we have clamps, different clamps for different teeth. We have special rubber sheets here, forceps for grabbing the clamps, the frame to put the rubber, and the punch to make the holes in our sheet. This is like a basic stuff. When you are just buying the rubber dam, you have all this stuff. Sometimes you don't have sheets there if you are buying just only the part of the rubber dam, but sometimes, and usually, it might include some few sheets too. But for proper use in the reality, in the oral cavity, we will need a few things that will work for us also, and this is, you might already recognize the floss. Also, you could use the special template like this one. This has this is the sheet which has the template on it, but there are templates that are in the box with the sheets. And usually it gives you the clue where you need to punch. And maybe you did your rubber dam placement just only one tooth because of your program and the abilities, but in reality, sometimes you need to isolate even the full quadrant or full jaw. So to isolate only one tooth, it's always easy. You're punching somewhere in the middle of the latex of the sheet, but for isolating nicely and like here, yeah, you see the row of the teeth, and you see how good the rubber is sitting. Sometimes you need such kind of the template which will guide you and which will give you the placement of the punch. So in the case you are using the template, you need to have the special marker, and you're just placing some dots wherever you want to make punch, and wherever you make 1 or 2 or 3 in a row, and then you are just punching it with your puncher. So, and you might also use the lubricant, which you might feel the need of the lubricant when you are using with your models, and you see how not sticky, but how it is hard to move the latex, because it's like doesn't want to move because it needs some liquid, it needs some lubrication for easy flow. So in the mouth you might have the liquid like the saliva, but usually we need to lubricate some places to move and to manipulate with the sheet easily. Sometimes it don't do the good job too, but usually we use it. And you might need scissors because after you are taking off the rubber dam, you might don't need to put it like each tooth from each punched area, and you just cutting it and take it out. So this is the basic kit. This is what you might need with it. In our case, we totally need the floss to be included because on the exam, you need a part of the flossing, which is absolutely mandatory. Any questions so far?
Doctor, for the exam,
Yeah.
we know that we have many clamps. We have for the premolar, molar. For our exam, what we need to know all the types of the clamps and which clamp is for the
So you have few clamps. You have molar clamps, premolar clamps, and frontal clamps. You on your exam will have only molars or premolars. That will be decided by the committee. I agreed not to take in account frontals, as we already mentioned. But the thing is that you usually, in reality, also have few clamps for molars, not only one. Yes, this is the same in your exam too. You need to identify which is the molar clamp if you have molar to isolate. And as I already said to you, you are using the one you think that you should use, then which is for molar. If you have the premolar, you need to take premolar's clamp, okay? But if you are using if you are isolating molar, and you're taking the one of the clamp, and you are putting on the tooth, and if you feel that this is loose or this is not enough supported and not sitting enough, you could change it on the other molar clamp. The key is that your observer will judge you if you choose the right clamp for right tooth, not if you choose the perfect one from the first time, okay? Do you understand me? Do you follow me? I mean, if you have premolar and you use the molar's clamp, this is the mistake. This will cut you out of the score. But if you have the molar, if you take the molar clamp and you use it and you see it with your fingers how it sits there, and you don't like it, and you think that it's better to use another molar clamp, it's perfectly fine. That's why you have there 2 or 3 molar clamps for you to use them, okay? So the question is, what is the mistake? And the mistake is to not to take appropriate clamp for the tooth you are isolating. Do you understand me?
Yeah, doctor, thank you.
Okay, we will now discuss which clamp is for which tooth. So for you to have in head which you need to use. Now, okay, so here we are with all the clamps, and you should know that there are lots of varieties of the clamp. Even maybe some of them I didn't even see with my eyes, because usually you use some very good quality clamps that have tendency to be used in multiple places. Not like you have 30 clamps and you use them every day, because there are specific clamps, you don't need them. And we usually identify the most demanded ones, and we have in our reservoir such kind of clamps. Now, I'm not suggesting you to know by heart any of this clamp. This is absolutely not necessary, but what you want to know is that we have 2 types of clamps. This is winged one and the wingless one. And for you, just for your eyes, because you see so much of them, let's take a close look and see this one. This doesn't have any wings, you could see. And this one has the wings, okay? Like here, it doesn't have any wing. This one have a wing. The same here, this one, these 2 are with wings. These are with wings, these 2, but these 2 doesn't have it. So now you can easily see which is winged and which is wingless. And you already know that you on your class have the winged one and the wingless one. What is the trick here? for your OSCE, the trick is that if you take the wingless clamp and use it, you wouldn't use it with every method of insertion of the rubber dam. Do you remember we discussed the 3 method? Okay, so that's why I prefer that the easiest part is to use the winged one, but maybe this is for me. Maybe for you it will be easier to use the wingless. I remember that when you were doing this, you more preferred wingless, if I remember it correctly. So the one thing you should know, which are for anteriors, which are for premolars, and which are for molars. Now, what matters here is the sizing. Size, guys, because as you know, actually for the anteriors, it's so easy not to get like lost it, because it is very much, this is called the butterfly clamps, and they are so different that you will never miss it with any other. Am I right? Yeah. So what is the thing with the premolars and molar clamps? If you have premolar clamp, you usually see that this place here is very narrow, and in case of the molar clamp, it usually is wider, and you, like, if you imagine the tooth row and if you imagine premolar, you usually easily understand which will suit premolar and which will suit the molar. Even though here the molar clamp has a smaller bow here, and here it might be wide, even here, it is still the molar clamp. It's just designed differently to fit the narrowest part of the molar. So what else we should know about the clamps? That they are supporting our sheets in the oral cavity. So the clamp is what is fixating your rubber sheet in the oral cavity. Because if the clamp is sitting and anchoring tooth perfectly, it will never slip away, okay? If it is not sitting well, when you will do your frame on your sheet, it might take away, it might go away. So I think that like for your exam, you need to be very familiar, if you will have premolar, not to miss the clamp which is for premolar and use it only. And if you have molar, in case of molar, you have there 2 or 3 different shapes, and you need to identify that they are for molar. So now, what do you think? Do you think it's smoothly and clear for you now, or still some questions to this case? Could you think that you will identify that by your size and by the shape? Even sometimes you see that people tend to see that winged clamps are more wider or bigger, and even though it is for premolar, sometimes somebody might think that this is for molar, but you usually, when you have this kind of mapping, you could see that they are really different in size, okay? And even on the practical, you could use them, you could just look at them and pay close attention that they are not the same. They are you could easily understand which is for premolar and which is for molar. Any question by now? No? If no, we're going to move forward. And now, so what is the problem with the clamp that I see when you are using the clamp? You usually get lost with its shape, and when you need to take forceps and put the forceps into the holes, I mean, it's not easy, maybe, but it's not too difficult also. But you sometimes miss the position. When we'll talk about the forceps, I will explain what I mean in the position. But usually, this part, this bracket part, this perforation part. This is the wing, as I said. This is anterior wing also. And in case of the wingless, I better love this old type of drawing here, because you could easily see that the points, these prongs of the clamp is in a touch with 4 of them. All of them are in good touch of the molar. This means that it will isolate and it will be sitting strongly, because if you have 4 points of the contact and they are equally distributed and they are sitting good, usually when you try it with your hand, it will be fixed. So this is the trick when we want to have perfect sit of the clamp. Not even in the OSCE exam, but in the real life too. If you are putting loose clamp, which is not fitting somewhere, or maybe tooth is a little bit wider in other parts, or maybe tooth has the you don't know the anatomy, and I couldn't say the difference between the upper and lower, but still they have different dimension from oral and lingual sides. And sometimes this gives us this kind of distortion when you are, even you know that this is the molar clamp, but it's not fitting perfectly. So you need to have good junction, good contact of the clamp prong on your tooth. Even though you have such kind of teeth on your wings, this is like a for enhanced gripping. But the most important part is that your prongs should be in the contact, not like all this part. Here you could see like it is grabbing with all his part. Here you could see that it is only putting its pointed prongs, and here you might have you don't need to have the touching, but yeah, in general, this is the most important part about the clamps. If you want to fix it, if you want to have the less motion of the clamp, you need to understand how it works. And it works like this. You need these 4 points. All of the clamps have their 4 points. All of them have this little prongs here. So these 4 points should be distributed evenly and grabbed on the tooth. So here is the basic scheme. I just want you to know these clamps, all of them, just to see how they appear. In reality, you might don't need it on the OSCE, but just to have it, okay? These are usually for the, this is for the frontal tooth. This is the B4 clamp, which is very, very tiny, very small and little. It is nothing like the premolar clamp. It is way much bigger than that. And yeah, here you could see these are premolars. This is premolar. This might be premolar. These two, these are orthodontals. This is premolar too. So this is just for you. Now, any questions so far? Nothing, I guess. I'm moving. Do you following me? Yeah? Are you following? Are you here? Are you understand what I'm talking about? I think that because you already did it with your hand, maybe you don't remember everything of it, but because you already did it, I think that you have more understanding of that. Okay, so, well, punch, it's a really easy thing for you. Just one thing to know, that the different sizes of the hole is for different tooth roll. For the centrals, you use the, you could see here on schematic. For the central ones, you could use the this one. For the frontal incisors, you use the tiniest one. For molars and premolars, you could use here in this range. And sometimes people use the widest one for like anchoring tooth, for winged clamps, when you need the big hole to put the sheet on the winged clamp. So for you on exam, be sure that this will be perfectly normal if you use the first one. I wouldn't recommend, you could use the second one too, but for you to not tear sheet, to not to get in a worry, just use this first one. Nobody will tell you anything about it, okay? So this is all about the punch. So what is a forceps and how we hold it? So forceps has different types. I will show you it in the other slides. And the thing is that you will grab your clamp with the forceps and remember one thing. The most that I saw in my life when people start to use a rubber dam, and I saw it in your classes too. Usually the mistake you are doing is that you are not putting clamp in the right direction. Now let's remind, if you remember, one of your, maybe not in, I don't remember in which group the girl was. She first took the clamp and she put it not with the bow in the front area, but she put it like her clamp's bow was like in the vice versa position. Okay. Of course, you could use this kind of placing, but in this case, you need to push your clamp in a different way. And for you not to get very like scattered about for this information, let's do what is the classic. And the classic is when you be on the exam, remember this. And when you take your forceps, I don't have anything like a forceps here for you to use, like I'll grab my phone, yeah? And if you take the forceps like this way, yeah, you have the wings here, and you have the clamp. Remember, when you put your this kind of teeth in these holes, remember that your bow, your arch, is looking forward, like in this picture, okay? Not on the opposite side. Because this is the mistake. In this case, you will put, and remember that your jaw should be in the right position in this case. If you have rotated it, you might get misled, okay? You have your patient's jaw in the right position, like this way. Here is his arch. And you're taking and putting this way. So I will demonstrate this in reality, and we will, I just want you to have the very good point about it, because this is very frequent mistake. And on the OSCE, your observer might cut you out of the score. I don't know, 1 or 2 or how many, but in this case, she will understand that you are not understand what you are doing. So be aware how you are taking your clamp. Okay, we will discuss this on the practice too. So, like here now, you could see where your forceps, where your holes are and how it is filled. And this bow should be in the frontal part. You are going inside the cavity with your bow in front. This kind of forceps are always, you might see this one too, like you have, and this one too. They are like the same, but a little bit different. This one is better, if you ask me, than that one. So frames, you could see a lot of the frames, a lot of the types of the frame. You could see the sizing of them. There are smaller ones which are for like children. Here are the like medium and large ones. These are the metal ones, stainless steel, and these are also the plastic ones. And I really love this form. It fixes fantastically the sheet, but usually you could see this kind of frames, and you work, as you remember, with this such kind of frame. And what you need to know about the frame, there is the point that you should always keep the open part of the clamp in the upper part of the face. So you put the clamp so that the open part is like in front of the nose, okay? If you are doing it reversed, in the reversed version, this is the mistake. So the proper placing of the frame means that you are putting it so that your open part, where you don't have any stainless steel, is under the nose. I think that this is the easy way to remember this, okay? Yeah, so yeah, this is what I want you to show, yeah? This is the placing, not like when you have the open part here and this part there, okay? I think it's easy, but when you are working with your when you are working with the model, you might get a little bit scattered. Also, look that the bow is always placed in the distal, not here. You are not doing it. Yeah, always remember when you're sitting with the model, I mean on the OSCE, you imagined like in this position, like you are sitting here and this patient here sitting in front of me, and he's like the model that you will have upper or lower will be placed in this position to you, okay? And you will be doing it in this position, so you always need to place your bow to the distal, not to the medial, okay? Keep in mind this picture. Keep in mind. So to talk about the sheets, they are produced in several hardness. This is slim, medium, and hard. We usually use for endodontics the slimmer one or medium. Slim are very uncomfortable. Actually, I don't really like the slim one. Medium is like more of the go, and the harder one, the heavy one, is perfectly used in restorative dentistry, and I will use this example too. Like here, you could see that we have the heavy latex. Before I go to the steps, now I want you to ask me any question. Okay, Raja, I see you have already written the question. No, not in the oral cavity. Guys, this will be too much for you, okay? You don't need it. Even though sometimes you might think that it's easier. I remember that one of your mates asked me, I want to do in the oral cavity the preparation. I mean that it's too hard, because in this case you don't have any skills to use the handpiece, and if you have extra problems like the oral cavity, like the opening, like you need to sit right, so this will give you extra tension, and I don't think that you are in this level that I should judge you how properly you are nicely sitting and managing all this stuff. You are not. So let's be real, yeah? You will have the model in front of you, like on our practicals. I think that they will give you the number of the tooth you need to isolate, and you will start your work. Now, I want you now to switch off your microphones if you want. If you want, you could type it. Let's remember how we're starting our isolation. What is the first step that you are doing when you are going to isolate with the rubber dam? Please, I'm here to hear you. It's okay to do a mistake. We already talked about it. We already did it. But if you are still confused, I need to see it, okay? Yes, first of all, check the teeth with the flossing. So, if you get, yeah, Marlene, please?
Yes, right. I was saying the same
flossing.
thing.
Great.
Yeah,
Good. Sorry, what? What was the last?
After first of all, we need to clean the teeth. Then we choose the clamp that we need to use. And then
Okay, let me do step by step, okay? First of all, you have to use floss. And if you already have the number of your teeth, if your examiner are telling you that you need to isolate, for example, for 3-6 or 4-6 or any of the molars or premolars, what are you doing? First, you are taking your floss and you are going in the mesial and distal part with your floss, just putting it under the contact. You remember this feeling of the pressure. If you don't remember, please do it on your own teeth. Do it flossing. It's beneficial. It's good for your health too. So you are just doing it and placing your floss nicely on your fingers and then trying to floss it. And when you see that you passed the resistance and your floss is already there, this is the good work. Great. And you already said that, Dennis, and Raja also said that then we are putting the clamp. And here I want you to think for a moment that the most important part for you in the exam is to identify which clamp you are using. Yeah. So as I mentioned, if you have the premolar, please be aware of premolar clamp. If you have molar, be very self-esteemed to use the clamp that is appropriate. Even if you put the clamp, what is the next step? Like before I go and skip to the next step, what is the next step after the putting the clamp?
we need to punch.
No. When you are putting the clamp,
checking if it's tight on the teeth, if it's not loose.
Yes. Yes. And be aware, this one is also the big, like with the big mark. Guys, I'm giving you everything. Like I'm like giving you the script of the exam. This is maybe not right. I'm not sure. But I want you to be, as I said, the thing about the placement, the sequence is most important. Even if you are doing everything right and you are missing the sequence, the observer could like take your score out. Okay, just a second. Just a second. Okay, now what did you do is that you put the clamp, then you try it with your fingers if it's sitting okay, and then you will see if this clamp is okay. If it's okay, you're taking it out. But if it's not okay, you just not only take the clamp out, but we'll switch to other clamp and see if the other fits. Are we clear about it? Are we?
Yes.
Yeah. Yeah. So first flossing, then identifying the clamp we need, using this clamp on tooth, then like doing it like the professional, you're like seeing how good it sits. Is it perfect or it's not? And your observer is like, you know, your body language talks much too, because if you are doing this thing, she understands or he understands that, you know, he knows what she's doing, yeah? So, Philip said, next you have to punch a hole in the rubber dam. Yes, if you are satisfied with your clamp, if you like how it sits. If you don't, you are switching to the same group clamp. Maybe the second one won't fit too. You could switch to third one, but it will be, I think it will be weird, and maybe your observer will think that, I don't get why he's not selecting so well. So be very cautious about it, okay? If you feel that it's very loose, don't be like, don't lose it, okay? Take out and see other. But if you feel that it sits normally and maybe a little bit distortion, you know that the models are not perfect, so this might be okay. And then, as Philip suggested, you could do a hole in your rubber dam, in your sheet, and let's say that you don't have the template. I thought I would bring one to you, but then I remember that you don't know the anatomy, and maybe you don't know the numbering, and maybe the template would drive you crazy, and maybe you will do lots of mistakes. And I took this part away, and I think it will be simpler if you just take your latex and punch it in the middle, and we will do it. You will do it. If you already done, you know that that's not like horrible thing to do. You're just punching in the middle, and this is perfectly used for you. Well, yes. And after that, guys, you have 3 options. But I want you to ask, who remembers which option you did? Which was the easiest for you? And which was the most, I don't know. I don't want to like, I will be more confident if you will be very good in one of these placement techniques, which one you select, no matter for me, because I don't want you to get scattered when you want to show your skills and you want to show how good you could do something, and then you have the 3 options and you might choose the hardest one, and you are not evaluated by the method you use, okay? So maybe because you are not evaluated by the method you use, maybe we will try to use the simpler one for you, okay? So on the practical, I think that we will choose the one of the technique, and we will improve in this technique, if you agreed. If you want, we could do the 3 of them. But basically, sometimes I think that I'm giving you the simpler technique, and then you choose the other one, which is more harder. So I don't know. But this is whatever you want, okay? Sorry, what? We can prepare it before put it on the tooth, or we can put the clamp on the tooth after the. That means, no. The first step that you did, the step you did, that you choose the clamp, and clamp is okay. After that, you, if you know which method you want, putting the clamp depends on it. There is technique when you put the rubber sheet on the clamp and put it with the clamp. There is technique when you put the clamp and then put the sheet on it. And there is the third technique when you put the rubber, the clamp, and the frame too, and they put this way, okay? I don't remember which one was more convenient for you. Do you remember which one you did? I remember that you did the second one. You put the sheet on the clamp, put it in the mouth, and then you did the, yeah, okay, yeah. Was it okay for you? Like this one was the simpler one for you? If this one was, I would try to focus on this one only, okay? Just to not to like making your life more easier, I think. Okay, so if we're, yeah.
I have a question. So, do we have to centralize the rubber dam sheet perfectly?
No, of course not. But
oh, so we don't lose marks on that.
Yeah, that's why I said that if you have template, it's easy to do by template, but template had also its disadvantages because it needs you to be perfect with the template. But with the sheet, you don't need such kind of, without the template with the sheet, you don't need such kind of the perfectness. I will approximately show you where to put your, when you are doing only one tooth. This works only when you are doing only one tooth isolation. If you want to isolate more, like not on the OSCE, but in reality, it's better always to have the template. Yes, so that's great that you are making sure for OSCE, because on OSCE you won't have template, so you need to punch it like approximately in the center for you to be easy to manipulate your latex, so it don't give you the overhanging, too much overhanging somewhere, okay? So where will we? Okay, yeah, the second method. Now, let's discuss and refresh our knowledge about the method, yeah? Then I'll give the videos too, but videos, they might not be so clear for you in the terms of the exam. So in the second type of the insertion of the rubber dam, you are doing what? You are grabbing your clamp, putting your rubber on the wings, and remember, if you are doing this second type, you need winged clamps, because without the winged clamps, the second option wouldn't work for you, okay? You need something to put your sheet, and this something is the wings that the clamp has. So you are putting the sheet on the clamp's wing, and then control your direction, control where you have the bow, control everything. Take it with a forceps, and you are putting on the teeth. And if you remember, we discussed how you are putting it on the teeth. You are doing one sliding down till the gingiva, and the other side sliding down to the gingiva. Like, you need to first one side, then second side, because if you're just putting this way, usually you missed the good placing, okay? So be aware of this motion. The one, you are just watching for one, and the second, you are watching for the second. And when you are satisfied, you're taking off the forceps, you leave the clamp on the tooth, and then you are trying to take all your sheet nicely. If you need, you could use the probe, or you could use the just simple forceps to make your sheet nice and to take the sheet out of the wings. And what is the next step, by the way? Very important one. Let's see who remembers. Next step.
Adjusting the rubber dam with the floss.
Floss.
Yes. Yes, it is. Yeah. So you did your work. You put your clamp with the rubber dam. You adjust with your probe or anything the rubber so that your wings are already free of the latex. And what do you need to do is to take your floss. You could use forceps here, as I showed you. If, like, don't give the examiner the illusion that you are not doing something or you are not capable of doing something. You are allowed to use forceps or probe and use your body language to show that you are doing this intentionally, because if you are putting floss and it doesn't go, it gives you like the trouble, don't over react about it. Be calm, take the forceps, take it nicely, easily, don't be afraid, don't worry about the time. I think that you will have for rubber dam placement approximately 7 minutes. I think it's totally enough. And after you go with your floss, you need also to feel the resistance. Now you are working with the latex too, because without the latex you also feel the resistance. It's not easy always to go under the contact, but with the latex it's even harder, yeah? So be very conscious that your floss need to penetrate the contact. It need to be taken down under the contact, and you will see it, not only you but your observer also hear and see it, okay? Yes, we do floss for the rubber dam. So what we missed and what we need to do to finish our work after we floss all our contacts, the distal one is more harder. You remember that you have the bow and you need to go under the bow with your floss. Yeah, mesial one, it's more easier. So what is the last step here? Please help me. Yes, 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 guys, the frame. And one more time, to be sure that you are doing frame in correct position, be aware that the open part is the upper side, where the nose is supposed to be. Now, because you refreshed your mind, now I'm going to the, if you have any question you could ask now, or I'm going to my presentation. So now, this is the great sketch for you to refresh everything you need. So identify the tooth that should be isolated. You should know which tooth you are working on, yeah? So look at it, identify, is it molar, is it premolar, what do you need, why do you need, and so. Take your floss. If you don't exactly remember which clamp you need, you have time because you need to do some flossing. And go with the mesial and distal contact. Do it, as I said, with the resistance, to push it under the contact, to feel it, to feel how hard maybe it is, but you feel it. Then choosing the right clamp according to your teeth, premolar, molar, frontal. This is not the case of the OSCE, but in the real case, yeah. Take clamp with a forceps and place it on the tooth. Then use your fingers to see how clamp sits on the teeth. If you feel that it is too loose and moving, change the clamp. That's okay. But if you are satisfied with the clamp, remove it with the forceps and choose method of application. In case if you choose the second one, you are doing everything properly, as we all discussed. After putting rubber sheet, use floss. Here I mean after putting the clamp with the rubber sheet. Use floss to make sure that your sheet is moved under the contact point. Then use forceps or probe whenever, if it's necessary. This might be this is not the mandatory step here. This you could use even here, even maybe there, whatever you want. Okay, and fix your frame on the sheet nicely. So any questions here? Do you feel comfortable? Do you see that this will work for you in your exam?
Yes, doctor. I have a question. Also, we need to remove it, or that's okay? It is
No, no, you don't need to remove it. Maybe, I don't know. Maybe I would be there for checking it, at least not only your observer, I don't know, but you don't need to take it out. I think this will be the part of the job of your observer to take it all down. But because you don't have the much time, I don't want you to spend this on just taking it off, because this is not the part where you are assessed taking off. But remember one thing, in your first station, we will talk about it, I think, on the next lecture or next practical, I don't remember. On the first station, if you remember, what we did on the first practical, this was to sit with the patient. In this case, you were adjusting and you were approaching the plastic head, and you need to adjust to the model. You need to take your lighting. You need to sit comfortably. You need to grab your probe and your mirror and to observe the patient's mouth. In this case, I'm talking about the plastic head, as it according to be, like from the upper maxillary part from the left. You know, this the hourglass, like clockwise direction. So in this case, remember, guys, that your last step will be to put everything in the first position, because if I go on the exam and because of my height, because of my composition, because of my knowledge, I start to approach the patient, I will adjust the stool, I will adjust the patient, I will adjust the lighting, and after me, somebody else should come, and he should start from the point of the beginning position. Okay, after you will do this with your first station, you're like switching off the light and putting the patient in the first position. Okay, do you understand me? This is an important point. Also, remember another thing that is important, that on every station you are doing your cleaning of your hands and putting your gloves. And after you're leaving the first station, you will need to take out and clean your hands. And this is the mandatory for every station. And this will be, if I remember correctly, it will be scored. Okay? For the first, yes, Wasam, you will be resetting for only first station. But for the others, there are the different things that you're doing. There is no resetting, okay? So remember these points, because everything you do, as I said, everything you do on the exam, everything might be judged with the point or maybe cut with a point. So sometimes, usually there is a little point, so such kind of things, not like a big ones, but I mean, we need all of them, yeah? So let me go to the other slide. Yeah, so I wanted this to show you, for you guys, this is the position. So remember that I said that I want you to remember where is your bow. Like here, do you see that bow is on the distal part? Could you see it? In this case, this is also, you could use this position in the reality, and you will need to use this in the reality, but try to avoid it on exam, because this might give you false position, and this will give you the false result too. Okay, so always remember to have bow in the frontal part, like here. Do you see the difference or not?
So the second one is wrong, right?
For now, for exam, because it might give you the vice versa effect of the, because you are not understanding the model, and now you are not understanding that in a space, this might be the upper jaw or lower jaw, and you always need to put your arc in the distal. When I was observing, when you were working, the problem was that you really don't get where the bow need to be. And when you start to work in the reality, like sometimes a few times you will have problem, but then you will recognize what your problem. But now for you, it's hard to identify this thing, okay? So the tip is for you to get easy with it, is to always remember this picture that you need the bow in front, okay? I think that this will help you more for exam than in real life. In real life, you might feel that this kind of positions and this kind of placements also sometimes is needed and mandatory too, but in OSCE, I don't think that it will help. Okay, this picture is just to demonstrate that what we need when we are talking about the good picture, like good isolation at the end, when your examiner will look at the isolation. The good thing is that she should understand that all the rubber now, this is the multiple teeth isolation, or you are not supposed to do this, but just see how nicely the rubber is sitting, yeah, how good it is. So for you to know, for your eyes to just remember the pleasing view of the isolation this is. So also I want you to see how deeper the floss is. This is not on this level. You could easily observe it, and your observer will easily identify it also if it is not pushed there. I don't know, I did like the quality of this, but this is one more thing I want you to show, that you could work with your latex, like, you know that this is a latex, this is a rubber, and it's flexible, but don't overestimate and don't push it too hard, because it might tear. Also, it might tear when you try to take out the sheet from the wing. Yeah, you remember how hard sometimes it is to take this out. So this is the method of second method you want to use. This is how it is before you take it in the mouth. This is the real correct position. The bow should be distally, and you put the forceps here, and you're taking it this way. So I have here I have here actually two not very perfect movies about the rubber dam, but I want now you to show it. Not because here is the perfect sequencing for your exam, but just for you to have these videos, because the visual training of your eyes to see some details, maybe you will have more questions about it when you will see. So now it's a little bit longer one. I will try to make it not so long for now, but then you could see it wherever you want at home, just to have more idea. Also, it's not very nice quality, but here you see all the important parts. Yeah, until we go to the video, do you have any questions? Do you need something to discuss? Okay, guys, are you comfortable with all these things? You get it? Good, good. So you can see here punch, the forceps, the clamp, also winged clamp. Here is the frame. This is the latex box, the sheet box. Some doctor here explaining to us how to put it. You could then listen to him. It's okay. Of course, his method of putting it doesn't mean that this is the method you should use. Of course not. Don't take it as a reference. This is not a reference, but just for good visual sight, I will suggest you to see it and to listen it. Okay, now he will show us how he's fixing the latex on the frame. And you could also use this technique. Now, could you see he's doing maybe multiple holes? I don't remember, but usually it's very easy to put the frame, the latex on the frame. In your case, you don't need this part, like you don't need to put the latex before on the frame, because you are taking latex with the clamp without the frame, and then you're doing frame. Okay, so for you it's like, now he's making some. This was the if you remember, the third method of insertion. Yeah, so now look at it. Now I'll see the better position. So look at it. The bow is in front, looking front, and your frame is always open, also in the front where the nose is. Well, he's now showing you the third technique. Yeah. Now he will do this a little bit more slower, and I love this part because you might observe it just for you to have the little more idea. Okay, even though you might not use the this type of insertion, you could use the latex making on the frame in the same way when you fix your clamp and the latex in the mouth. So he's doing everything of, oh yeah, I love this part. You know, this part is also good because you need to do it without a frame, but still you need to do it. This is how you're pushing the wings under your latex, and then you're putting. Actually, I think that this type of insertion is the easiest one. And I tell you why. Because in your case, you don't have the mouth and you don't have the patient who needs to open as wide as he could, because when you are doing this in reality, this third method, when you use the frame and the clamp already put all together, you need your patient to give it the wide opening, and it's not easy to put it. But with the clamp, with the model, you don't have any resistance there, and you just can put it very easily. But I don't want you to force to use this method, because usually I don't know any dentist Except I think that me, who is using this approach, because I don't know why, but usually people think that this is the hardest way. I don't know. If you will feel that this one after the video, or maybe before the lecture, this one is better for you, why not? You could try it. So just, this is up to you. Well, now he will put here in the holes the forceps. Okay. He's securing it. And then he is putting it right into the mouth of the patient. Let's see one more time. Of the bow is distal and the nose section is, voila. That's it. But here he needs to take out these parts on the wing. This you will need to do with your model 2. This part. Don't remember that you need to take off the sheet from the wings. Well, usually then you are just putting nicely, lovely. You could put that the way you want. So what do you think now? Is it too hard? I think that still it might be visually hard to maintain this kind of technique. Well, and one thing you remember that when you see it, it looks very easy, but usually when you are doing it, it's more confusing. Okay, so think about it. Think about which technique you need. I will show you other video too in a speed version, and then you will have time. Also, you could see lots of videos that are on YouTube. I mean, but I don't want you to give you lots of them, because I don't want you to like, you have some frame now, the exam frame, and we need to stay into this frame, guys. So if I will load you with the lots of ideas and the videos, that might get some confusion. So I'll try to give you one or two, and then you will be deciding. So here is the same thing she's explaining. Here you see the template. Template has usually this kind of form, and you could put here the dots. You're putting on the template the rubber, and you're putting the dots on it, and then you are punching these dots. Now she will show us these things. But now, you know, here is the tricks too. That's why I don't want you to use, because you need to push it a little bit upper, a little bit down. Sometimes it's not correctly. Still, people are doing mistakes. So I just don't try to get you overwhelmed. Well, she's putting his punch size, whatever she wants. And she's giving you example how you are moving your head. If you feel that somebody moved it, maybe like not intentionally, and this is not on the huge part, you could usually rotate it, and it's very easy. Now, this is how you are punching it, very easy, but try to hold your latex so that you have the clear, not wrinkled view on it. So now she will show us the clamps. Now she'll show us how to take it from the model. Okay. How to hold it. Great. And now she will doing the part. You need to be very, I mean, the quality is really very bad. You can see in the focus, but you could see, you could observe. Now you could observe this thing, how she put it on the wings, and she will now be moving it to the oral cavity. Well, she started from the beginning. She's checking the clamp size in the patient's mouth. If she would like it, she would use it. Now what she's doing, she's checking That's a great part to check it. Well, she put the latex on and took the rubber into the mouth. You will be doing this on the model. You see it. She now you could go with a probe or with the forceps. You could taking out these parts from the wings here. Usually it's a little bit hard when you don't have any liquids in the mouth or lubricants in your case on the model. Don't worry if it stuck there. So now she's now making she could now making this sealer on it. It's not your part now. You could do this. Well, you could see it if you want, and here are the different types of the frames also. As I said, there are the plastic ones. You could use it if you like it. In reality, we will use, the metal one. Yeah. Okay, I think that's enough. I think that you understand the point, and after the lecture, you could easily see these videos. In the OSCE exam, we will do the rubber dam just for the posterior teeth. Yes. You will do it for the posterior. Everything you will do on the OSCE, this will be all about the posterior teeth. Now, for the next lecture, guys, we will be talking about the preparation. Please inform your friends, because, as I said, like today's lecture is the good way to prepare you. It's like a preparation. Well, nobody asked me this, and nobody maybe wants me to do this, but because the OSCE is very strict exam, and sometimes it needs some kind of directions for you, I need you to be prepared. I need you to be mobilized, because I see your capacity. I see that you understand some things. Maybe you are not doing some things perfectly, but you understand it. So because you want good grades, because I want you to have the more and good results. So I think that you should be prepared in every way, like mentally, because when somebody's observing you and you're doing something, if you guys I could easily see when I'm coming to you, when you are preparing, you're starting to be more tensed, and that's totally okay. But remember that you will be one-on-one with your examiner, and this examiner won't tell you anything. She couldn't tell you, couldn't give you any clue. She will be observing very how to say, annoyingly maybe, every step you do. And so you need to feel, and you need to show your confidence. And I'm telling you this because I know that you couldn't be confident in this case. You are not yet there in this phase where you could, but actually what they were asking you, you already done. So you already know. And as I already said to you, you are observed about how you could handle things, how you could handle stress, how you could understand what you're doing, how your mind and hand work. And maybe you are not perfect in your form and shape, but consequence, the sequencing, and these little details. So as I said, you need to be very prepared for it, as mentally as with your skills, in every dimension. So questions. Well, I'm not sure that I could be an observer. I'm not sure that I could be the one. I will be there. Of course, I will be monitoring these things, and you will have I couldn't say say that they will be examiners. They might be the observers mostly, but they will judge you. They will judge you, and they will put the points there. Okay. Well, that's a great question about the 10 points. Well, I have a few ideas about it, and I talked with your dean, and we are discussing these 10 points because there is no reference how you could use these 10 points. This is totally up to me how I need to use it and how I'm gonna use it. Yeah. So one thing is that I know who is doing what. Also, I know who is dedicated. Also, I see who is not dedicated, who is talking too much and not doing the work. You know, there are guys who are constantly making the mess in the class. So, yes, I have lots of ideas how to manipulate these 10 points. Because when I see that somebody is doing everything to be engaged, to do their best, to do like in class, in lecture, the participation in the lecture, guys, I once said, and I think that everybody remembers, that I will be using these two, because if I am here for you to lecture, I don't get why from the 30 or 32 or some, I don't know how much you are, people only 7 is with me, okay? And I think that this effort that somebody is doing, just not sitting somewhere with the friends, but sitting with me here on a lecture, this is the effort too. And I have all the names and surnames who were and who were not on my lectures. And I already mentioned this fact on the practical too, so you can say that you don't know that. So these 10 points are a really good weapon for me to evaluate the other skills, not like only how somebody is working on the model. I'm not evaluating this. I'm evaluating your character, how you are dedicated, how you want to learn, how you are helping your community to get advanced, but not like doing the worst job to not to give others opportunity to do their job. Okay, so yes, I would use it wisely and nicely, be sure. Any other question? What else? So you're here 7, yeah? Who is going to do exam now on the 28th, if you already know? Because you don't have much time to prepare, I guess. So Philip, you're going to do it on 28th. Okay, good. Who they picked, but I don't think that they are going to pick somebody. I think that this is up to you. If you want, you're doing it. That's totally up to you. But I'm pretty sure that that this is the less than doing in January. So please be sure that you already talked with Salome, because as I remember, she said that if you are not going to tell her soon enough, then she couldn't change something. If I remember, I'm not sure about it. Just ask it with Salome, okay? Maybe you already asked her. Maybe she already knows about your wish. So I just want you to say that, don't worry, but you have less time, because I guess the other students will have more time to like also get the information from you. Maybe this is a big advantage for others who are going to do this in January. You know, this is the part that when the first comers are going and doing these things, then the comers are having more easy way because they know how it was. I don't know. So I think if you don't have any other question, I will now give you the chance to go rest or do your work, whatever you want. So anything else? Okay, just one thing. Please, inform your friends, your mates, that these lectures are very important, and then I won't be answering any question regarding that what I already talked to you like for hour and a half I'm talking. I'm not going to lose this time on the practical. This is why I'm doing this here now and not on the practical, because in the practical side I don't need to talk for an hour. I need you to do your job. So yeah, I'm not like doing this. Okay, guys, have a nice evening. Stay strong. I believe in your capacities. So goodbye.